Blood Money episode 63 with Dr. Thomas Levy. Nearly all heart attacks come from dental issues and other health hacks that they try to hide from you. All right, we're on the next episode of Blood Money. Today we have a very special guest, Dr. Thomas Levy. How you doing, sir?
Just fine. Thank you for having me.
Thank you very much for coming on our show. Sir, so you're a board-certified cardiologist and an attorney. That alone is pretty impressive.
Yeah, I like to say I'm working toward becoming a member of every group I hold in the lowest esteem.
Oh, wow. I love that you said that. So that's interesting. So let's talk about the bar. I mean, I guess you're mentioning that as one of those groups that you hold as in low esteem, or?
Actually, after much of the pandemic has transpired, I hold my lawyer colleagues in much higher esteem than my medical colleagues.
Really? Wow. Tell us about that.
Well, no, I mean, just look at what's happened during the pandemic. Look at the medicines that have been prohibited, the therapies that have been prohibited. I mean, and the doctors that not only go along with it, some of them fought it to their credit, okay, but many others were just more than happy to be told what to do. Look, the Nevada governor early on, by executive order, prohibited the prescription of hydroxychloroquine in Nevada. I mean, I don't think you have to go much further than an example like that. And then to see how the doctors went along. Go ahead.
Why did you choose Nevada's governor as an example? I'm just curious.
Well, that was the one major political executive that went out of his way to actually write a specific executive order banning it. I mean, there was no subtlety about it. A lot of politicians like to do things to look one way while they're doing the other thing. He didn't care. He said, I'm not permitting the prescription of hydroxychloroquine in my state. So that's why I cite that.
I mean, that's just insane, because he's not even a doctor. I mean, what right does he even have to make such a decision?
Well, that's the whole point. None at all. None at all.
None at all. None at all. Yeah.
The whole lunacy of the pandemic has been the tail wagging the dog.
Yeah. I mean, we see this in every industrial complex. I mean, medical industrial complex being just one of them, but it seems as though this is a epidemic of corruption across all of our industrial complexes.
Well, I certainly believe that it's hard to look at the situation and the facts that have evolved over the last 2.5 years and come to any other conclusion. I mean, it's as long as you're willing to think on your own and not just rely on what the mainstream media tells you as being the fact, there's really no other logical conclusion that I can think of to explain what's going on here. As a matter of fact, it's gotten so bad that I think one of the main benefits, actually, of the pandemic is that the public finally might be losing their trust in a medical system that does not have their best interest in mind.
Exactly. I mean, is it accurate to say that some of these individuals that were in the know are responsible for crimes against humanity via cowardice?
I would certainly say that. I don't know that I'd say via cowardice. Cowardice, I would say by intent.
Wow.
But not by cowardice per se. But yes, the thing is though, and this is the difficult thing throughout this whole pandemic, where you see another crazy thing getting banned or another doctor being losing his license for speaking the truth as he sees it and has he reported in the literature, is it's not. Well, it certainly becomes apparent that the role of medicine is not primarily geared with the welfare of the patient as the highest interest. And that's something we all want to believe in, but hey, guess what? There's not an industry or a profession or anything on the planet that doesn't place money first. And medicine is no exception at all. But this distrust is we don't know yet, could actually allow the patients and more people around the world to realize the phenomenal benefits of things such as high dose intravenous vitamin C, and a host of other different natural products and this, that, or the other that obviously don't make a lot of money, but they do make the patient better.
Yeah, yeah. This is the sin of our time, where very simple things like vitamin C is being ignored because the industrial complex cannot make gazillion dollars off of that because vitamin C is generic. This is not putting people's health first. This is not following the Hippocratic Oath. How did we get to this point? How do we get to this point that there's so many that are literally willing to play in this game of corruption where lives are ignored while profits are paramount?
Well, this is my own take. I mean, I look at the mainstream press, and I mean, they drink their own Kool-Aid every day. There's so many things that they say that to a logical person are outlandish, yet if you actually look at it, they believe in what they're saying.
Yeah.
And you see, my goodness, you see the journalists dropping dead or collapsing on live TV programs and everything else. Yet it doesn't cause any pullback at all by the other ones that are in the journalism field. So I honestly don't know. Probably very few people have the awareness that the pandemic wasn't conducted in the proper fashion. Let's put it a little more diplomatically that way. I mean, they well, it's like politics, and I've said many times before. Medicine has more politics in it than politics does. Okay, and this is because you really don't know, like, in the right versus the left, without getting into any details of political people. There's so many things going on in this woke culture now, where you can see that they absolutely believe everything they're saying, no matter how crazy it is. That there's nothing wrong with having drag queens in front of 5-year-old kids. They see nothing wrong with that at all. And so you have to realize that they've gone down a complete road where once something is set up by whatever the mainstream is, they just blindly adopt it, period, end of story. Yeah. And so there are really very few people in the profession of journalism that actually practice journalism and that actually weigh anything objectively. So I think there's very few people that have the big picture. I mean, we've even seen videos of mainstream high-level politicians in the United States and around the world collapsing on camera, collapsing during a speech. So a lot of them drink the Kool-Aid and still don't realize, even though we have a massive amount of literature now indicating the toxicity of the spike protein, and the fact that the spike protein, in addition to coming from COVID, is also supplied in great amounts by the vaccinations.
I mean, how is this different than other historical calamities and injustices? Like, you look at something like the Third Reich, where a whole population, or at least a significant portion of a population, believed in insane untruths, believed in insane levels of fascism, literally lived a life for years, had to be, after World War II, re-educated to take those racist, anti-Semitic, ridiculous views out of their mainstream. How does it differ? How does woke culture differ from that? Yes, we're not putting Jews in the gas chamber and killing them, but we are killing people. It's the same thing is happening. It's a genocide before our eyes. How is this different?
Overall, not a whole lot. I mean, you brought up something right there, and I got to say that I was extremely surprised, absolutely blown away when, I don't know, a few weeks ago, maybe a month ago, Dr. Paul Offit, who has been one of the most adamant pro-vaccine people out there for a long time, and, just saying, if you don't get your vaccine, you're crazy, or whatever, or you shouldn't associate with other people, you should be banned from society. And then lo and behold, a light switch goes on, and he actually reads the literature, and now he writes a letter to the New England Journal of Medicine saying, wait a second, we got to stop giving this vaccination to kids. I mean, I didn't think he had that capacity. I thought he was a 100% Kool-Aid drinker that was going to stick to vaccination at any cost forever and ever. So again, I come back to the fact that when you see somebody talking passionately about something versus logically, you still really don't know if there are certain buttons that can be pressed that can actually make them realize there might be a little more to the situation than the way they perceive it. But I couldn't believe somebody as adamant as Offit turned around and was willing to put it print, stop the
Yeah.
vaccination for the kids. Because, I mean, practically no kid dies from COVID or even gets severely ill, yet they're inflicting something that causes myocarditis, pericarditis, neurologic syndromes, you name it. And in times past, all you need would be one or two or three episodes like that to shut down a vaccine. But now there seems to be no limit. There seems to be no limit of reports that you can make that causes them to slow down. I mean, there's a certain areas on the fringe where they're starting to appreciate this, but you still have the CDC pressing forth full force to vaccinate kids. And although there's a lot of issues out there, probably the biggest issue right now is stop vaccinating the kids, for goodness sakes.
I mean, the kid, I respect that doctor for changing his viewpoint, but I mean, it seems like the kids is one topic, but it's not doing much good for, a lot of adults either. It doesn't seem like, especially when, the side effects are myocarditis. I mean, are we really like helping anyone with this vaccine?
Well, I haven't seen any evidence clearly that has told me what the vaccine good is supposed to do. Supposedly, a vaccine's designed to prevent the illness. And early on, it showed that it didn't prevent COVID. And so they shifted focus and said, well, it doesn't prevent COVID. You just don't get it as bad when you get it. I mean, talk about change your message on the fly. Let's just completely change the message of, even though a vaccine is supposed to prevent something, well, it doesn't really prevent it here. It just attenuates it. Well, and then I don't know. It's very frustrating to not just see such a lack of logic, a lack of appreciation, but obviously it's very frustrating to see how vigorously political forces, and they're pulling medical schools in and medical boards and hospitals. I mean, they're getting them all on the bandwagon to shut down anybody that even raises a question, even when they're referring to a legitimate, scientifically conducted article in the literature saying, well, let's have this. Okay, let's discuss this. Okay. Because ultimately, you have to come down to, is the vaccine preventing more harm than it's causing? That's your simple question. That's the simple question. And there's clearly a substantial amount of harm being done. And based on what I just said, the fact that there seems to be no attenuation of contracting COVID based on having the vaccine, it doesn't seem on that particular data that the basic premise of a vaccine is met, which is to prevent more harm than it causes.
Yeah, wow. And, credit to you for having the courage to speak this truth, because it is a vaccine that has not been tested. It's ridiculous what's happening. It's more than a comedy of errors. And there's unfortunately very few like yourself that have been brave enough to stand up from the start. So thank you very much for doing that. In terms of your focus right now, let's talk a little bit about that in terms of how oral cavity infections and heart attacks have a relation. I believe you're right here that most heart attacks are due to oral cavity infections and other kinds of dental work, shoddy dental work. Can you tell us a little bit more about that?
Yeah, actually, I was conservative in the title because I didn't want people to just reject it because the title was too extreme. But yes, virtually all, well over 95, 96% of heart attacks from atherosclerosis blockages in the coronary arteries comes about because you have seeded pathogens from infections in the mouth inside the lining of the coronary arteries. What's the evidence for that? Well, In 2007, a Dr. Ott did angiograms on, I think, 38 different known coronary artery disease patients with blockages. And he did what's called an atherectomy. So through the catheter, he went in and literally roto-rooted. He'd scrape out the plaque to open up the blood vessel, but then he also analyzed the plaque. And in the plaque, he found over 50 different bacteria, viruses, fungi. And he found it, most of them from known oral sources. And he found them in 38 out of 38 patients, which I like to say a bit tongue-in-cheek is pretty doggone close to 100%.
Yeah.
So, I mean, what on earth are oral pathogens doing inside the artery of the coronary artery and its blockages? And it gets seeded from these infections. And why does that cause atherosclerosis? Well, when you have an ongoing, not a flagrant infection like you're systemically infected, but you have a low-grade colonization of oral pathogens in the coronary artery, those produce powerful pro-oxidant toxic substances. And a pro-oxidant uses up the antioxidants, which also in this case is vitamin C. Bottom line being, when this is continued in the artery and you can't wipe it out, and you don't because you continue to release new pathogens every day and toxins in the bloodstream, all the vitamin C is used up inside the blood vessel wall. This causes an acute inflammation. Acute inflammation heralds in the immune system to try to neutralize that inflammation. The very first cell that shows up when you have an inflammation caused by these pathogens in the blood vessel is the monocyte. And guess what? The monocyte has 80-fold, 8,000% more vitamin C inside it than any of the other cells. So literally, the immune system is using its white blood cells to try to deliver vitamin C to an area of the body where it's been depleted by this infection. But it can't do it. So because the pathogen, if it was a one-time hit of pathogens, that would do it quite nicely. But it's not a one-time hit. It's a continued seeding every day. Now, why does this cause atherosclerosis? Well, when you don't have vitamin C inside a structure like a blood vessel, the blood vessel becomes physically weak in strength, in duration, in durability. That's because vitamin C is needed to make the structural protein, collagen, cross fibers to make a strong vessel wall. Well, when you don't have the vitamin C, the vessel wall becomes very weak. Well, the body is designed to try to compensate for things that it needs but can't get a hold of. So what's the worst thing that can happen to somebody with weak coronary arteries? Well, they would blow up like a balloon, rupture, and you die. So if you don't have the vitamin C there to make the structural protein, then how do you start to compensate? Not completely. How do you start to compensate so that the wall just doesn't expand and rupture? You start growing plaque. You actually, your only compensation for not being able to make a strong wall is you start making a thick wall. And that's atherosclerosis there in a nutshell.
And that clogs up your arteries basically when you start getting plaque in the arteries.
When it gets big enough, it blocks off the blood vessel, and then you have the heart attack. Yes.
Wow. So vitamin C. I mean, vitamin C sounds like a very useful vitamin, yet the medical industrial complex doesn't seem to be pushing it as much as doctors like you. Basically, vitamin C is cheap. That's why, right? Or am I incorrect there?
No, that's correct. I mean, it's very inexpensive, and I mean, a lot of people, I think, don't want to believe that it's true or can't believe that it's true, but it's a very tough pill to swallow, no pun intended, for people to believe that their cherished doctors do not have their welfare at their best interest. As long as the doctor and the hospital are getting paid an adequate amount of money, hey, if you want to get better, fine. but
Hmm.
it's not the main point. And I mean, at a more cynical but still realistic level is when you make people well, not just
Hmm.
treat their symptoms, but when you make people well, you lose patience.
Yeah.
Okay, and my goodness, the healthcare industry is just an incredible monster, size wise, and everything else. And
Hmm.
uh, and to make it even worse, they're not happy with good profits. They have to make unconscionable profits.
Yeah.
So they have
Yeah.
no problem at all putting a middle class guy in the hospital for whatever heart, this, that, or the other, getting an operation, a bypass, a valve, this, that, or the other, you name it. And they have no problem at all completely bankrupting that family. I mean, there's just no conscience involved.
Yeah.
And
Yeah.
there's
Yeah.
and there's no reasonable fee involved because most of the stuff that's done in the United States you can get for a song outside of the United States. I mean,
Yeah,
I've
which
spent a
by the
lot.
way, you describe a lot of our legal industry too. I hear horror stories all the time with, lawyers and, especially in the family law world, which it's kind of like it seems like the goal is to really bankrupt everybody as opposed to do anything in the better interest of anybody, which, seems to be a recurring theme with all these industrial complexes.
Yeah, it's kind of like the well, there's so many ways the powers that be can neutralize somebody, and obviously making that person struggle to make a living or feed the family or meet mortgage payments is a very
Hmm.
prominent way of making sure that people don't express an honest opinion. I mean,
Hmm.
the funny thing is we're talking about this, and probably most of the people that watch your program at some level already realize this. But we got to stop complaining and we have to start acting. Okay, I
Hmm.
just um, at whatever level you are, play a part. Even if it's
Hmm.
if you think you have no power at all, you still have a power to affect the election of your local politicians, which then
Hmm.
spills over to higher politicians. I mean, don't stand up for somebody who has no problem at all. Like I said before,
Hmm.
allowing a drag queen to give a show to your 5-year-old. Okay, and you have to be willing to speak up. It's it does nothing at all, and this is everybody listening to this. It does nothing at all to just whine and complain.
Yeah.
Figure out something that you can do positive to carve your own little niche and do it. But just stop complaining because nobody cares about your complaints. They care
Yeah.
about you realizing what's going on and doing your best to stop it and turn it around.
This is my big issue. I actually ran for office in 22, and my big issue is you have voters out there that are very well educated, that read on the issues, and you knock on their door, they're excited to see you. They want people to be a force for change. That's about 25% of the doors you knock on, right? And then you have 75% of the doors that are apathy, that people that are too into their PlayStations and their televisions and their Netflix, and they just don't get involved. And that's how these crimes against humanity happen, by apathy. What, sir, have you seen in your history, your background, that's informed you to be a voice for righteousness as opposed to be one of the cowardly ones and not speak up?
Well, I'm not presenting myself as just some sort of force or something like that. Hey, look, I told you what I feel is a situation with so many other doctors, and I'm not trying to set myself up as some sort of incredibly moral person. But the bottom line is, I did go into medicine to help people, okay,
Hmm.
to make it better. And when I start to see things that make people worse, and I start to see things that suppress ways to make them better, you have to be true to yourself and you have to be true to what you believe and you have to be true to the people who are looking to you to give them your best. Even if it's
Hmm.
not going to resolve things, you need to have enough reliability so that people respond to the fact that they feel you're going to do what's best for them. And, I'm not out to poke any bears in the eye or anything like this, but by the same token, gosh, it's if you're witnessing something that's taking a life rather than restoring a life, I feel you got to say something. I mean, I don't want to be melodramatic or anything like that, but you ask about my motivation. That's my
Hmm.
motivation. I mean, uh, I'm not a rich man by any means. I've made a living. You know, I have a home, and not much beyond that. Okay, so I'm not. I'm not. I mean, it'd be nice to have a $10 million high-rise penthouse in Miami right now, but that's not even a remotely possibility. So you just gotta separate the issues. And so anyway, I don't hold myself up to be somebody special, but you ask me why do I do what I do, and I feel compelled to speak what I think to be the truth,
Hmm.
and to also make it clear to anybody that questions me or wants to throw darts at me is, look, I mean, I'll show you the information that I have to reach the conclusions that I reach. If you're interested in a logical academic discussion or argument. But I think
Hmm.
we both know most of the folks, the physicians, the healthcare workers that would follow these other pathways, they're not interested in that analysis. Do they
Hmm.
think at some level that I'm right and they're wrong and they don't want to get into the argument? Maybe, maybe not. I don't know. As Mark Twain said a long time ago,
Hmm.
and it's one of the most phenomenal expressions I've ever heard, is Mark Twain said, you can fool anybody,
Hmm.
but you can't convince anybody they've been fooled.
Yeah. Yeah.
And I mean that desire to never be humiliated is so powerful.
Yeah,
It's a
Mark Twain. I just got to tell you, I mean, that man is an absolute genius. That is one of the most genius sayings. Sorry to interrupt you.
no, that's fine.
Yeah.
But it's people. You talk about sex and power and everything like that, and what motivates people. I put up there humiliation avoidance right up there
Hmm.
with sex and power. People will
Yeah.
do anything at all, especially if they're a professional that they know the public expects them to
Uh-huh.
be on top of things and more intelligent than them and everything else. That person, he or she, will
Hmm.
do just about anything not to have it show that they're wrong and that they were promoting something or supporting something that was completely incorrect. And going back to what we talked about earlier,
Hmm.
that's why what Paul Offit did blows me away, because I don't think many of the people that are in the quote unquote pro-vax department
Hmm.
look at any literature at all. I
Yeah.
mean, they've got their conclusion and they're running with it.
Hmm.
So for Paul Offit to come up and say, "Hey, let's back off on the kids," and put it in writing in the New England Journal of Medicine, uh, my hat's off to him a little bit.
Yeah.
I'm not ready to say he's a great guy for what he's done in the past, but
Hmm.
he does show the fact, which is very rare in my opinion. He does show the fact that he's willing to say, "Hey, I was wrong about this. Let's stop it right here."
Yeah, yeah. I mean, isn't it like a hallmark of extremist times, fascist times, where you were mentioning that I don't see myself as a hero, right? The first thing that popped in my head is that Schindler's List movie, because theoretically Schindler should have not been a hero either, right? And the reason he wasn't a hero is because he did the right thing in tremendously dark, extremist, fascist times, right? And that's why your regular person that's just like, yeah, I want to do something good as opposed to do something that's clearly evil, turns out to be heroes in those times. So anyway, I just want to point that out to you. I mean, you are heroic in the sense that when you have like a very small percentage of individuals standing up for what is true, those individuals that are standing up are the heroes of our time.
Well, like I said, I don't consider myself that, but I appreciate what you say, and I appreciate those sentiments. I am, though, minimally encouraged, though, that things that relative to a year ago, things are better now than I thought they would be a year ago. A year ago compared to now, where now we have more and more situations where there's more examples of what's happened. There's more videos. I mean, gosh, in this day and age, everybody with their walking with their camcorder, if you will. I mean, before you had to have this big bulky thing. If you wanted to make sure, if you see something happening and you record it, which is nobody's going to do, but now everybody can document everything in a second, basically meaning it's much more difficult to completely hide an agenda for an extended period of time now than 15 years ago or
Exactly.
longer. Okay.
Yeah.
So that's, I mean, you can argue the positives and negatives of technology and all, but I tell you what, the multiple functions of the cell phone, and not the least of which is the camera and the video, have have changed so many things, mostly for the positive. But I'm not a blind supporter of all technology at any cost. But I always like to say I wish we could live in the 60s with the cell phone forever. That would be my ideal.
Oh yeah, yeah, yeah. 60s, I mean, 1910s too. There's a few periods that the cell phone would have came in handy.
Oh yeah, well,
you know,
I don't have any recollection of 1910, but I do
yeah.
recollect the 1960s, and I'd have loved to have been a high school, college student, med student with the cell phone and everything now, just research and all that.
Yeah.
But you can't always get what you want.
Exactly. I mean, sugar seems to be with these cardiovascular issues and tooth decay and that sort of thing. Sugar, I'm assuming, is one of the biggest issues because sugar leads to tooth decay. Tooth decay leads to dental issues, cavities, root canals, and then that leads to heart attacks. I mean, am I connecting these things correctly?
Yes, and the thing that the book Hidden Epidemic was the book that has all of this stuff in it. It makes the point, and this was a major discovery for me, that when I talked to dentists that were friends of mine, I got to say, they didn't realize it either. And that's not a knock on them. It's just the fact that in the literature, it turns out there's tons of people who have infected abscess teeth that are completely symptom free. And I'm not talking about the root canals. The root canals are also infected. But when you need, in anybody with heart disease and actually any other major disease, to get what's called a 3D cone beam examination, 3D x-ray, if you will, of the mouth, because then it goes and rotates, so you can see all the different angles, and it's the only way to clearly tell if a tooth is abscessed at its tip. And if it is, it's really got to come out, okay? Now, why does this occur? Well, guess what? Surprise, surprise, the body and the mouth break down over time, okay? So as you get in your 40s, 50s, 60s, hey, look, your skin doesn't look the same. Well, your bone quality isn't the same either, and your tooth quality isn't the same. So at some point in time, maybe you chew too hard on something, you cause a little crack in the tooth, and then the bacteria and virus and fungi make their way down to the tip of the tooth, form an abscess, and next thing you know, you have a chronically infected tooth that you didn't even know you had. But the thing is even though you don't know it's there until you look for it, it's going to take you down. Heart attack, diabetes, cancer, you name it. So the mouth must be properly addressed. Not just the heart. The heart is just a good example because heart disease kills so many people. But in the women, if you do thermography in women with these infected teeth, you see the red streaks coming down their teeth and going onto their breast. Red meaning warmth, and the warmth coming from lymphatic drainage of infected teeth.
Wow.
So these are all important considerations. And matter of fact, it's kind of interesting. Not too long ago, somebody who had done previous interviews with, very nice person, very knowledgeable, said, "Well, will you come on and do an interview? I want to talk about the benefits of exercise for heart disease." And I said, I said, well, I can't honestly come on a show and talk about the benefits of exercise for heart disease without talking about toxins in the mouth. Because if you
Hmm.
have somebody 55 years old with 2 or 3 root canals and other infected teeth, the last thing that person needs to do is to exercise vigorously until they get the mouth taken care of. Then,
Wow.
then the exercise is good for you. But the
Mm.
exercise is not good for you in terms of longevity and potential heart attack if you keep pushing yourself to a high blood pressure heart rate index while you have infections in sight.
Wow.
So it was sort of funny in one way because this is one of those. It's not a myth, but it's overemphasized, which is exercise is good for everything. So
Hmm.
just do your exercise and protect your heart.
Yeah.
Well, it does have a positive impact, but nowhere close to the impact that a good diet and a clean mouth will do for you.
Wow. Yeah, I mean, when you're saying that, I started to think about some of these victims of the COVID vaccine, like a lot of athletes falling, dying, myocarditis. Seems as though whatever calamity is happening with these COVID vaccines seems to be targeting athletes more because of their blood flow. I mean, is there parallels there potentially?
You know, there might be some differences in incidents, but I don't think it targets the athletes so much per se as what the athletes are on camera. All right,
Mm,
who's looking through an ordinary neighborhood and
yeah,
watching the housewife cook her meal and then suddenly collapse? No, there's no camera there. But
yeah.
you got a big soccer game, you got cameras from all angles. So I think it's more a reflection of the fact that those are people of which other people are aware of and see, and they follow them and they keep track of them. That also the high level of exercise.
Hmm.
A lot of people, I think, I can't tell you how many, but a lot of people I feel have a low grade subclinical myocarditis. That means that's not a myocarditis that a regular doc or cardiologist would say exists. I mean, they like to see certain parameters go above a certain level, and then they say you've got myocarditis. Well,
Hmm.
I'm saying you can go much lower than that and have an extremely low grade inflammation. But guess what? If it's inflammation in the wrong cells in the heart, and all of the cells in the heart are not uniformly affected most of the time by a myocarditis, but let's say they focus in on myocardial cells that have to do with the conduction system. And what happens when any cell is inflamed? It becomes unstable. These cells are electrically active. So
Hmm.
when you inflame them, you increase their susceptibility to throw off an extra beat, have a rapid heart rate that could be inconsequential or could be
Hmm.
fatal. And
Wow.
then when you have who knows how many people exercising very vigorously with these slightly inflamed cells in the conduction system of the heart, what happens at peak exercise? The big surge of adrenaline. And then it's like gasoline on the fire. Okay.
Mm.
And this was another issue too, where we came up with the pilots. We're talking about the pilots having this, and we need to be concerned about them because in the cockpit, they have adrenaline type circumstances now. This is just,
Hmm.
but the point being is this number is just growing. I just went on a website and they have, since they started counting about 2 years ago,
Hmm.
1,700 documented different soccer star either deaths or incapacitations on the field. And you got to remember
1,700.
this
Wow.
too. 1,700. You got to remember this too.
Wow.
Uh, it doesn't happen while they're sitting on the bench. It happens while they're doing that exercise, just like the Buffalo Bills player. I
Hmm.
mean, I think I think calling that a cardiac contusion was ridiculous, but you can't argue it one way or another with one person. All right,
Hmm. Hmm.
you just it always remains a well, I say this, you say this, blah blah blah. But the
Hmm.
fact of the matter is you have a lot of this going on. I mean, it gets depressing. I just looked at a video from somebody who sends me things, and a beautiful young woman and her two colleagues on camera, and you sit there and you just watch her collapse. I mean, what does it take? What does it take? I mean,
Hmm.
what does it take? When you look at these soccer stars, all right, before 2000, how many soccer stars dropped dead on the field?
Yeah.
Ever?
Yeah.
Maybe one every 10 years, maybe one every
Hmm.
15 years. So, and again, uh, you just, and the thing too is, I talk about this as being a spike protein mediated disease. Spike protein is the part of the COVID pathogen that allows it to enter the cell. And that people have chronic COVID tend to keep the COVID pathogen and have excess spike protein. But what is the vaccine? The vaccine is a deliberate injection of spike protein or the
Hmm.
messenger RNA that's going to make a spike protein in your body.
Hmm.
And this is also why, because the spike protein is toxic in and of itself. This is why we see what appear to be cumulative effects. Somebody might get the first shot, do
Hmm.
fine, get the second shot, a lot of problems. Or they go through the first two shots and do fine, and then get a booster and they go down.
Hmm.
Okay. It's like, how much toxin can you fight off? Can you sustain? Can you neutralize? And you're always going to have a point where you exceed that. And I think the evidence indicates that even though you might have a long-term spike protein presence in somebody with chronic COVID, I think the titers of spike protein, the amount of spike protein provided by these vaccinations, especially the boosters, is
Hmm.
enormous. Is enormous. Okay, and everything is cumulative. Toxins are cumulative. I mean, if you have this many toxins, you got to come up with this much antioxidants and repair. Okay,
Hmm.
so you can't just continually pile on without having something to go on to neutralize that toxicity. And this is still not being properly addressed, but we have some individuals. We're going through some protocols with very high dose intravenous vitamin C and a few other interventions. Simple. I mean, the whole idea is to have a protocol that's simple and accessible. I mean,
Hmm.
there's a dozen or more different ways, probably 20 different ways to knock out the COVID pathogen and ultimately to knock out the spike protein. But they're expensive, they're inaccessible. I mean, hyperbaric oxygen therapy is great, but hey, that's expensive. You got to find someone. Ozone
Hmm.
therapy is fantastic, but there's not that many ozone practicing physicians out there. And so other things like the vitamin C, and even if you can't find a physician who'll give you intravenous vitamin C, the protocols can be modified so that you take a very large regular dose of vitamin C orally, along with agents such as cortisol to help push the vitamin C inside the cell and ultimately knock out the spike protein. Other agents too, like methylene blue, believe it or not, are
Hmm.
incredibly potent anti-pathogen agents that knock out the pathogen in the blood. They block its binding to get
Hmm.
into the cell, and they kill it after it's in the cell. So like three prongs. Combined
What?
with the fact that we have some enzyme agents now that we know of that have been
Hmm.
documented when you take them orally, documented to help dissolve the spike protein. Because a protein is a protein, a bunch of amino acids. And if you get the right proteolytic enzyme in there, it'll just dissolve that enzyme, and then you'll have nothing left but amino acids, which is then beneficial for the rest of your body. But you got to have the multi-pronged approach. You got to
Yeah.
knock out ongoing virus infection. You have to knock out existing spike protein, and you have to strengthen the immune system, and then you start to get good results. But unfortunately, none of the mainstream medicine there's no prescription medicine that does this.
No,
Okay,
it's so sad.
so
Yeah.
we come back to that whole issue of mainstream medicine versus integrative medicine, and the
Hmm.
fact that everything in mainstream medicine is designed to support the pharmaceutical industry because the pharmaceutical industry supports them. I
Yeah.
mean,
Yeah.
It shouldn't come as a surprise to anybody to realize the amount of money pharmaceutical industry invest into doctors beginning their first year, their first day in medical school. It
Yeah,
just starts from then on,
their
continues
own.
in the practice. Yeah.
Their own from the start. It's no different than our politicians of how, I ran for office in 2022, and if you go down a certain route of being owned, you seem to do very well because that's how these industrial complexes nowadays seem to work. You're speaking about vitamin C orally. I mean, what kind of high doses of vitamin C orally are we talking about?
Well, a lot of this oral vitamin C, regular vitamin C, has the downside, if you will, of
Mm-hmm.
some people are sensitive, and if they get a certain amount, they get a loose diarrhea because the vitamin C accumulates, doesn't get well absorbed, accumulates in the colon and rectum, pulls in fluid, and you get a flush. Which,
Mm-hmm.
incidentally, that flush is still good for you, but that's another story.
Yeah.
The thing is, and this is all part of designing a good protocol.
Mm-hmm.
That's why you would initially, if possible, want to give IV vitamin C to get over it, to get on top of it, and then
Mm-hmm.
sustain your benefit with the oral. But even if you can't do that, using good liposome encapsulated forms of vitamin C tend to be absorbed better.
Mm-hmm.
Other things are you take vitamin C for some people, if you take a little at a time over an extended period of time. So most people, if they just take 3 or 4 or 5 grams all at once, they're going to get the loose diarrhea. But if you take those 3 or 4 or 5 grams and sip it in a juice or glass of water over an hour, hour and a half, and then do that again later in the day. So there's ways you can work around the sensitivity and get the vitamin C inside your body. But the goal is, nevertheless, to get those vitamin C levels up as high as possible in your bloodstream. Yeah.
Yeah, I mean, I was at a medical event over the weekend, and one of the speakers there mentioned how he knew from day one that this whole COVID thing was a sham because he did some research about South Korea in March of 2020 and realized that the story was just not lining up. It wasn't making sense. He had also actually heard about some of these treatments like vitamin C. And lo and behold, he checks the internet again 6 months later, and all that information was scrubbed out, which told him that there's a globalist element to all of this. There's very powerful people that for some reason are into this agenda of what he thought, and these are his words, that this is some kind of population control mechanism, profit before people. I mean, what do you think about that sort of thing? That this information was available from day one, and most of these doctors just didn't want to do their own independent research.
Vitamin C has been suppressed for 80 years now. Okay, so
Oh wow,
that's not news to me. It might surprise somebody right now that doesn't know the history of vitamin C and what it's done and what it can do. An interesting point too is that roughly 80% of all the vitamin C on the planet is produced in China. I actually had the opportunity some 5 or 6 years ago, long before all this crap hit the fan, to go with a Chinese American internist colleague and give lectures on vitamin C to a number of groups in China. And I was amazed how much they were using intravenous vitamin C at substantially higher doses than anywhere else in the world. And then at the beginning of the pandemic, the very little known fact, I think, is one of the major vitamin C producing provinces in China shipped 50 tons of vitamin C powder to Wuhan. Now, my goodness, why would they be shipping so much vitamin C in the middle of a pandemic? And the interesting thing is it's all awareness too. You could have shipped that 50 pounds of vitamin C to any city in the United States, and it had just gone bad in the warehouse. But in China, they knew what they were doing. Now, there's lots of, this is not a defense of China or anything like this. This is just, I'm giving you some facts here. Make of them what you will. I mean, I don't think anybody knows the overall game plan. We just know bits and pieces of it, and are forced to reach some sad conclusions. But hell, I can't begin to understand what's going on. And like all the examples we talked about already, there's so many people that I think have no logic at all do end up
Hmm.
succumbing to logic every now and then, and others not. What did they just have, that group of Hollywood stars that want to get Hollywood to ban anybody? Even now, they want to ban
Yeah.
anybody from producing or acting in a Hollywood production that's not vaccinated.
Well, the good
My
news
God, what?
there is the good news there is, as somebody from Hollywood that grew up in Hollywood, I came up in the Hollywood industry. I've been in Hollywood since I was a kid, and I got to tell you, Hollywood's talking about canceling all these people. Well, the rest of the country's canceling Hollywood. Hollywood is doing very bad. Their movies are failing. Nobody likes Hollywood anymore. Frankly, the content has like lacked artistry for years. I mean, literally, we're in the worst period of art. Maybe the 50s with their, with the paranoia and all that would be akin to what's going on right now. But this is definitely an era that won't be remembered because, frankly, all the art sucks. Sorry.
No, I stopped watching Hollywood movies a long time ago. I broke my pattern, and I'm glad I did, for Tom Cruise's Top Gun movie, where he came back, and
Yeah.
I
Great
my
movie,
hats.
right?
That was a great movie. I
Great
just
movie, man.
great movie, but I can't say that. I mean, the rest of the time, I watch telenovelas produced in Mexico and Colombia. That's my main entertainment. I don't even like any of the NBC, CBS, ABC shows. Not the least of which is today they can't just entertain you. They can't give you a drama. They can't give you a
Hmm.
comedy without presenting a freaking woke agenda or some other crap. They can't just entertain. They always
Hmm.
have to preach to you. And
Yeah.
if I just see a little bit of that, I'm not interested
Yeah.
at all.
I could tell you a quick little story. So, as a TV producer and executive producer, I was brought in to help start a network in 2016 that was financed, I think, to the tune of, I don't know, like one office alone had $300 million budget. I think the total budget was like $6 billion. Within a year, they completely destroyed the company because they brought woke politics. They started getting rid of all the experienced producers, showrunners, and they brought in literally these woke purple hair people, and they destroyed the whole company. End of
Well,
the
I'm
story.
not surprised to hear that at all. I mean,
Yeah,
no, I mean, what's sad these days, too, in my opinion, is the almost complete destruction of the higher education system. Not just the high
yeah.
schools, we know about that, and the grade kids, we've known about that. But I mean, you have PhDs from Ivy League schools now that, I'm sorry, they're as dumb as a rock.
Dumb as a
They
rock. Yep,
just
yep.
they might have passed their exams, they might have filled out their multiple choice right, they might
Hmm.
have told their professors what their professors want to hear, and then they get validated, but they're not somebody you want working with you or working for
Hmm.
you at all, because they don't know a work ethic, they have no basic logic, and usually they're wedded to a whole group of philosophies and policies that have nothing to do with mainstream America. So
Yeah.
I'm so happy. My child, we found a great online high school, and I've looked at the curriculum, and it's good and it's solid and everything like that. I'm so happy that at least at this point in time, I'm dancing around that mine for the time being.
That's it. I mean, just the fact that you have to say that is just crazy to me. That like, just I got my child in a school where his brain won't be destroyed. Like, it just that sense to me is, the contradictions there are insane. Um, Dr. Levy, is there anything that we didn't talk about that you'd like the viewer to know? Is there any websites that they should go to? Anything that you'd like to say in closing?
Yeah, my website is simple. It's peakenergy.com.
I'm
P-E-A.
actually going to write this down real quick to make it really
Okay.
easy for the viewers. We got this cool little ticker here. Let me write this down.
All
So
right.
PE
Peak, peak
peak
energy, peakenergy.com.
.com. All right. So let me add this to the ticker below. All right, peak energy. Here we go. We're going to show it there. Is it showing? Yep, now it's
Yeah,
showing.
there
Is
you
that
go.
correct?
Perfect. Perfect. Yes, sir.
Peakenergy.com. Awesome.
Yes, sir.
And what could they expect at Peak Energy? It's how to reach
Oh,
out to you, or?
I have a whole host of articles there that go into
Mhm.
a lot of different subjects, and most all of them are very, very well referenced. A lot of people, I offer my opinion on a lot of stuff, but I do my best whenever I'm lecturing or writing an article and I go off onto a little sidetrack. I do my best to say, now this is what I'm going to tell you is my opinion based on the
Mhm.
logic. So I try to differentiate information I present into this is the opinion that I've reached versus here's the facts. Here's the facts as established in the literature, etc. So um, there's a lot of stuff, a wide range of issues. There's ways to order any of my books. I've written 13 books now, and
Mhm.
especially probably most pertinent is rapid virus recovery, which interestingly enough, that's a way that people learn about nebulized hydrogen peroxide to knock
Mhm.
out COVID and other early viruses where they're still just in the nasopharyngeal tract and in the lungs. And
Mhm.
I even offer that book if they write me a note at peakenergy.com and say, "Can you send me the free downloads?" I offer that book as a free PDF download as well.
Wow, wow. How often do you hear that, people out there? I mean, these are the real doctors, because real doctors do that. They're not. It's not profit over people. If that book could help somebody, and you got the PDF, the fact that you send it to them for free, I mean, that is really marvelous, and especially
It,
nowadays.
it was very highly rated on Amazon for about 6 to 9 months, and then out of the blue, they just took it
Oh, of
down.
course, of course, of course.
So,
I want the viewer to know. So I have your bio here. We didn't talk about, your accolades. The doctor that's sitting in front of me, Dr. Thomas Levy. I mean, this is a highly decorated doctor. Is that even the correct term, decorated? You know,
well, I don't have any medals, but
you don't have medals, but you're in the orthomolecular medicine Hall of Fame. I can't even pronounce the word. That's how big of a word that is. You've written 13 books, have you said? My phone's ringing here, so let me turn this off real quick. Sorry. Yeah, so you've written 13 books. You are on the cutting edge of this research into how dental work affects people. And so you know what you're talking about. You know what you're really talking about. You have the experience, you have the knowledge. I mean, it seems like you've reached the height of your profession.
well, I I don't know about the height of my profession. The whole idea of being in any scientific endeavor and still
Hmm.
being alive and having a functioning brain is that until you start to get dementia, you should be a little more informed and a little better the next day versus the day before. So, I mean, my goodness, the last 5 years have been not just the pandemic, but a couple years
Hmm.
before then have been an incredible uh, odyssey and journey and learning new information. Even though a lot of the stuff we've talked about has been around for a while, the the details and the data still comes in, and there's still, it's for me, it's exciting. A lot of people, they might say, well, Tom, what are you going to do this weekend? I said, oh, well, I got this book, or I'm going to read this article, or I'm writing this article. They said, oh no, relax, have a good time. I said, this is my recreation. This
Yeah.
is me having a good time. So I'm fortunate in that I'll certainly never retire, because to me, retiring means you're going to stop doing something you really don't want to do, or
Yeah.
that
Yeah.
you no longer have the capacity of doing. But
Yeah.
that's,
God, honestly, God bless you for saying that, because that is the motto I live by every single day. When you do what you love, it's no longer work. And
no, no,
I
absolutely.
work my ass off, but I don't have a job. That's what I say to people.
There you go.
Yeah. Well, Dr. Levy, thank you so much for coming on our show. It'd be amazing to have you on here at a future date to do a follow-up and talk about what you're doing. I'm sure sounds like you live a very fascinating life every day. So an update episode in the future would be great.
All right. Sounds
Yeah.
good, sir.
Thank you very much. And for the viewers out there, check out americahappens.com, where every day we're publishing new episodes with fascinating individuals like Dr. Thomas Levy. And yes, we'll have many new episodes, many shows on there. We have about 7 shows going on America Happens as we speak, and we look forward to you joining us.